Okay. Now, from the perspective of what you've probably primarily heard in terms of the current state of healthcare in Liberia, could you just comment on, particularly in these outlying areas, what types of healthcare would be available to people?
Well, now, not only on the outlying area, I'll start with the city first.
Okay.
A few years back, there was what they call the JFK Memorial Hospital, which is John F. Kennedy Memorial Hospital. Used to be one of the front runner as far as medical health provider in the entire West Africa, but today it's in ruins. So just within the city alone, it's just the city. There's not adequate health facility to take care of these patients. Then versus going back away from the city, which is, I mean, it's unfathomable. You can't even imagine, the healthcare system is everything is so dilapidated that it's beyond imagination. So the health workers are basically taking risks by trying to doing the best they can to treat these infected patients.
Yeah, and that's something that we'll be focusing on a fair amount, and it's really the focus of an initiative that our two organizations have together, which is to ensure that healthcare workers in Liberia have access to the personal protective equipment, or PPE, that they require. These are things like gloves, face masks, goggles and or face shields, covering for their body that doesn't let liquids through, because one of the big challenges with Ebola is, though it's not a airborne disease, then when you get in intimate contact with the person who has the disease, it's very possible that they will be vomiting blood or have other type of bodily fluids that are infected, and that's how healthcare workers can not only be infected but also infect others.